Sexually transmitted infections are commonly referred to as STIs or STDs. These are infections that you get through sexual contact. So they're found in the body parts that you have sex with, whether it be your penis, your vagina, your throat, or your anus. A lot of people are always concerned that they can get it from some sort of object. Just know that sexually transmitted infections can only be picked up through sexual contact with another person, and not something like a toilet seat. They are typically talked about in two different categories: curable and treatable. Curable STIs are STIs that you need to take medicine for them to go away. Their names are chlamydia, gonorrhea, syphilis, and trichomonas. Chlamydia and gonorrhea are incredibly common. 1 out of 4 sexually active adolescents will test positive for one of them at some point. Curable STIs are very much like strep throat. If you take the medicine you're given and wait a full 7 days before having sex of any kind, and that means even with a condom, the infection will go away. It is also important to get your partners treated because just like strep, it's very easy to get again. Treatable STIs are things like HSV and HIV. HSV is a virus commonly referred to as herpes. You can have HSV-1, which is more commonly found on the mouth and is also commonly referred to as cold sores, or HSV-2, which is more commonly found on the genitals. Even though they are more commonly found in separate places, it is possible to transmit HSV-1 from the mouth to someone's genitals and vice versa. HIV is a virus that is spread through sexual contact and activities like sharing needles. While these are STIs that you will always have, both have medications that you can take to treat the symptoms. If you take your medication for HIV as prescribed, you cannot transmit the infection to another person. If you take the medication for HSV, you are less likely to transmit it to another partner. The best way to prevent getting an STI is to make sure your partners get tested before you have sex, and to use a condom when having any kind of sex, including oral sex. If you are having oral sex with a vulva, you should use a dental dam. Most sexually transmitted infections do not have any signs or symptoms, and that's why it's so important to get tested regularly. This can be after every new partner, or if you're having new partners more frequently than once every 3 months, you can get tested once every 3 months. There are also some vaginal conditions that may cause bothersome symptoms, but they are not considered STIs because you do not usually spread them to other people. These are things like bacterial vaginosis and yeast infections. If you're having bothersome symptoms, it's always a good idea to give your medical provider a call. Testing. 1 in 4 sexually active adolescents will have an STI at some point, and 80% of those adolescents, so 4 out of 5, will not have any signs or symptoms. When I'm talking about signs or symptoms, we're talking about discharge, pain with urination, or odor. It is important to get routine testing. The earliest you want to get tested after a new partner is 2 weeks after you have sex. And if you're having new partners more frequently than every 3 months, it is recommended that you just go for testing once every 3 months. When it comes to testing, a lot of people are concerned about what that looks like. When someone says they will test you for an STI, that usually means that you are going to be tested for chlamydia and gonorrhea, which can easily be done by running a test on a urine sample. These are STIs caused by bacterial infections and can easily be treated by a one-time dose of antibiotics. It takes 2 weeks for chlamydia and gonorrhea to show up, and this is tested through urine if you're having sex with your penis or vagina. We can also swab your throat or anus if those are the body parts that you use for sex. If you would like to have your throat or anus tested, you use this swab to get a sample from the area. We will have you do the swab yourself. We can also help you with the throat swab if you need. You can also be tested for HIV and syphilis with a blood draw. These are infections that you can be tested for 1 month after sex with a new partner. Some STIs that we test for less frequently are trichomonas, that can be found with a swab or in the urine, or HSV. We only test for HSV if you have a sore or blister that we can swab to get an accurate test result. Testing does not require a physical exam unless you're having signs or symptoms that you would like a provider to look at. It normally takes about 24 hours for the results to come back, but this can vary from clinic to clinic, so you should check with your medical provider. If you were to ever test positive for an STI, you want to make sure that you tell your partners that you've had since you were last tested, so they can go ahead and get tested and treated. Also, make sure that you tell your current partner so that they can get treated, because we don't want you to get reinfected. If you have any questions, you can always text us at 720-593-9880, or you can give us a call at 720-777-2248.